Hello, dear students. Welcome back to my channel, Learn with Professor Janula. Today, we are going to talk about a very important topic in maternal and child health, postpartum family planning. Now let us talk about postpartum family planning. Postpartum family planning is the practice of preventing unintended pregnancies and avoiding closely spaced pregnancies during the first 12 months after childbirth. It helps protect the mother's health, supports proper recovery, and ensures better care for the newborn. Choosing the right method at the right time is essential for the well-being of both mother and baby. Postpartum family planning is critical because a woman's fertility can return as early as 4 weeks after childbirth, especially if she is not exclusively breastfeeding. This means that even while recovering from delivery, she can become pregnant again. Using effective family planning methods during this period helps prevent unintended pregnancies and allows the mother's body to heal properly before the next pregnancy. Postpartum family planning aims to protect the health of both the mother and the baby. It helps improve birth outcomes by allowing adequate spacing between pregnancies. Additionally, it supports overall family well-being by giving parents time to recover, care for their newborn, and plan for the future. Now we will discuss the objectives of postpartum family planning. First, it helps prevent unintended and too early pregnancies. By using effective methods, women can avoid getting pregnant too soon after childbirth, which can be risky for both mother and baby. Second, it allows the mother adequate time for physical recovery. Spacing pregnancies gives the body enough time to heal and regain strength before the next pregnancy. Third, it reduces maternal and infant morbidity and mortality. Proper spacing and planning of pregnancies lower the risk of health complications for both mother and child. Fourth, it promotes exclusive breastfeeding without the risk of pregnancy. When pregnancy is prevented during the first months after childbirth, mothers can focus on providing optimal nutrition and care to their newborn. Finally, it provides women and couples with informed contraceptive choices. Education and counseling empower families to select the method that best suits their health, lifestyle, and personal preferences. Now let us discuss the return of fertility after childbirth. For non-breastfeeding mothers, ovulation may return as early as 4 to 6 weeks postpartum. For mothers who are exclusively breastfeeding, ovulation is usually delayed, but it is not guaranteed. It is important to remember that the risk of pregnancy exists even before the first menstrual period returns. Understanding the timing of fertility helps women choose the right family planning method and avoid unintended pregnancies. Now let us look at the methods of postpartum family planning, starting with the lactational amenorrhea method. It is based on the natural infertility that occurs when a mother is exclusively breastfeeding, has not yet had her menstrual period, and her baby is less than 6 months old. When all these criteria are strictly followed, LAM can be more than 98% effective in preventing pregnancy. It is a simple, natural, and temporary method of family planning that supports both maternal and infant health. Next, let us discuss barrier methods of postpartum family planning. Condoms are one of the most commonly used barrier methods. They are safe for postpartum women, do not affect lactation, and provide the added benefit of preventing sexually transmitted infections. Diaphragms and cervical caps are another type of barrier method. These should be used only after 6 weeks postpartum, once the uterus and cervix have returned to their normal size and position. Barrier methods are effective when used correctly and consistently. They offer temporary contraception and can be a good option for women who prefer non-hormonal methods during the postpartum period. Now let us discuss hormonal methods of postpartum family planning, which use synthetic hormones to prevent pregnancy. Progestin-only methods include pills, injectables like Depo-Provera, DMPA, and implants. These methods are safe for women who are breastfeeding and can be started immediately after delivery. Progestin works by thickening cervical mucus to prevent sperm from reaching the egg, and sometimes by suppressing ovulation. Because they do not contain estrogen, they do not affect milk supply, making them suitable for lactating mothers. Combined hormonal contraceptives, which contain both estrogen and progestin, should generally be avoided during the first 6 months of breastfeeding. This is because estrogen may reduce milk production. For non-breastfeeding women, combined pills or patches can be started as early as 3 weeks postpartum. After 6 months, combined hormonal contraceptives may be used even by breastfeeding mothers if needed, provided they are carefully monitored. Hormonal methods are highly effective, convenient, and reversible. Choosing the right method depends on the mother's health, breastfeeding status, and personal preference. Nurses play an important role in counseling women about timing, safety, and correct use of these methods. Now, let us discuss intrauterine contraceptive devices or IUCDs as a postpartum family planning method. There are 3 main timing options for IUCD insertion after childbirth. Post-placental IUCD. This is inserted within 10 minutes after the placenta is delivered. It provides immediate contraception before the mother leaves the delivery room. Immediate postpartum IUCD, inserted within 48 hours after delivery. This method is still convenient and safe, offering early protection against pregnancy. Delayed insertion. This is done 6 weeks or later after childbirth, once the uterus has fully involuted and the risk of infection is lower. IUCDs are highly effective, reversible, and provide long-term contraception. They are an excellent option for mothers who want reliable, extended protection without daily attention. Proper counseling and follow-up are essential to ensure safety and effectiveness. Now let us discuss permanent methods of postpartum family planning. Female sterilization, also called tubal ligation, involves surgically blocking or sealing the fallopian tubes to prevent pregnancy. It can be performed within 48 hours after delivery, known as postpartum sterilization, or after 6 weeks once the mother has recovered. Male sterilization, or vasectomy, is a safe, simple, and highly effective procedure that prevents sperm from reaching the egg. It requires proper counseling and informed consent from the partner. Permanent methods are suitable for couples who are certain that they do not want any more children. Nurses play a key role in providing education, counseling, and ensuring that decisions are voluntary and informed. Now let us discuss the nursing role in postpartum family planning. Assessment. Nurses begin by identifying the mother's reproductive goals, medical conditions, and cultural beliefs. Understanding these factors helps in providing personalized care. Counseling. Nurses provide clear, unbiased information about all available family planning methods, helping mothers make informed decisions. Education. Nurses emphasize the importance of spacing pregnancies by at least 2 years to protect maternal and child health. They also correct common misconceptions about breastfeeding and fertility and teach mothers the correct use of their chosen method. Support. Involving the partner and family in the decision-making process strengthens support for the mother and ensures that choices are respected. Follow-up. Nurses encourage mothers to return for checkups, monitor for side effects, and provide ongoing guidance to ensure effective use of the chosen contraceptive method. Through assessment, counseling, education, support, and follow-up, nurses play a crucial role in promoting safe and effective postpartum family planning. Now let us look at the barriers to postpartum family planning. One major barrier is a lack of knowledge or counseling, which can leave mothers unaware of available options. Cultural and religious taboos may discourage the use of contraceptives in some communities. Misconceptions about contraception and breastfeeding can also prevent mothers from choosing safe methods. Limited access to health services makes it difficult for some women to obtain the method they prefer. Finally, the influence of family or partner decisions can affect a mother's choice, either supporting or restricting her options. Addressing these barriers is essential to ensure that postpartum women can make informed decisions about their reproductive health. Postpartum family planning is an essential part of maternal and child health care. By counseling and supporting women soon after delivery, nurses help prevent unplanned pregnancies, promote healthy spacing between children, and improve overall health outcomes for both mother and baby. That's all about postpartum family planning. If you liked this video, don't forget to like, share, and subscribe to my channel for more nursing learning videos. Thank you for watching, and keep learning.